This is Focus on Your Health, your radio home for news and stories from Kingman Regional Medical Center, here on the KJAZ Radio Network. I'm TG LaFredo, and joining me this week is Dr. Justin Garrison. Hey, Dr. Garrison, welcome.
Thank you.
This is something new for the program. I've never interviewed a resident, but here you are.
Honored to be the first one.
You are the first. I've been looking for somebody to talk to about what the residency program is like. So you're the victim. But first, we should talk a little bit. Let's introduce you. Who are you? Where are you from?
My name is Justin Blake Garrison, DO.
Okay.
I'm a family medicine physician here at Kingman. I'm a second year. Born and raised in Phoenix, Arizona. Went to medical school out in Kirksville, Missouri. It's the mecca for osteopathic medicine. It's where osteopathic medicine was started in 1892 by Dr. Andrew Taylor Still. So I feel very honored to have gone to the founding school. In Kirksville, Missouri, that's where I did 2 years of my training. Did my last 2 years back in Phoenix, Arizona, or did my clinical rotations.
That sounds like it would be a tough program to get into if it's the epicenter.
It is.
Yeah.
You know, it's a lot of history. Back in Kirksville, they actually have, on campus, they have a historic museum, which is pretty cool because a lot of DOs from around the country, even if they didn't go to Kirksville, they'll make it back to Kirksville hopefully sometime during their career to kind of see where osteopathic medicine got its start.
What is the difference between the DO track and the MD track?
Okay, well, first off, there's a lot of similarities with osteopathic medicine, DO and MD. Right. Both DOs and MDs are the only two licensed physicians in the country. The real difference between DO and MD is DOs were trained in what we call osteopathic manipulation, hands-on manipulation. Basically, we're able to diagnose and treat various conditions with our hands. A lot of times, patients don't like to take over-the-counter medications or prescription medications. So osteopathic medicine is another tool in our bag that we can offer patients to be able to heal, be able to be treated without the use of medications.
Right.
That's really the basic difference between the two. There is a little difference in our philosophy. With DOs, we tend to look for more natural ways of healing. For instance, if you sprained your ankle, a lot of times doctors will just really tell you to ice it, maybe get an x-ray. If you came to an osteopathic physician, we'll definitely look at those options, but we have some techniques that we can do with our hand that can actually aid the healing process. Instead of being out of work or off of sports for a week or two, maybe you're only off for a couple of days. So it's really that last 2 to 3 days you're getting extra by seeing an osteopathic physician, in my opinion.
It's a little more down the path toward holistic medicine, maybe?
There's definitely some holistic principles
Okay.
in osteopathic manipulation. I think that's fair.
Because I see DO, MD, but of course you all practice together. You all have, basically you're going by the same guidelines. You just have a slightly different approach in your training.
Yes.
Well, you were telling me that they're not going to be two distinct camps anymore, right?
Correct. And all of medical history, for postgraduate training, there's always been MD residencies and DO residencies. Starting in 2016, all residency programs are going to be combined.
Okay.
MD and DO is only going to be one program,
Right.
Which is very historic in the medical community. There's been a lot of debate back and forth and medical literature at national conventions. But about a week ago, it was ruled upon that all residency programs will be combined. And to be honest with you, I think it's a good thing because we've come a long way in medicine. MDs, there's a lot of MDs out there who actually practice more like DOs and a lot of DOs who practice more like MDs. So I think really combining the programs is just going to be better for everybody in long term.
Makes sense, yeah. You can be a DO and practice in any different subspecialty, right?
Correct. And that's one of the reasons I went into osteopathic medicine, because I felt like I can go into any specialty. If I want to go into surgery, if I want to go into cardiology, I have the same opportunities as MD. But with my interests, I have more of a sports medicine background and sports medicine interests. I like to do hands-on. I felt like going to a DO school will give me more training. Therefore, I'll be able to treat my patients more effectively in the future.
And at some point, you made the decision that you would go into family medicine.
Yes.
And that keeps you close to the sports community that you're interested in?
Correct.
Yeah.
One statistic I read about 5-6 years ago was 90% of teen physicians are actually family practice doctors.
Wow, okay.
So that was one of the main reasons I went into family medicine.
Yeah. We'll get into the sports aspect in a little bit because I know it's an important part of your life, one of your main interests. First, I want to talk a little bit about this residency program here at KRMC. You're just beginning year number 2.
Yes.
And what has this program been like for you?
This program has been great. I had my chance to go to a lot of different programs, and KRMC was my number one choice. It was my number one choice for many reasons. My training, medical school, was in a rural area. Being from Phoenix, I was always familiar with Kingman, driving through to get to Vegas. I knew about the patient population. I knew about the opportunities in Kingman. Being able to work in a small community is very important to me.
Okay.
Being able to talk to my patients at the grocery store, being able to talk to a lot of my colleagues and regarding patient care. Right. I think that's very important in medicine.
Yeah. Has the place lived up to your expectations in that regard?
Definitely.
Yeah.
Definitely. I've had numerous cases that I've worked up over at the residency clinic and needed help from a lot of my colleagues and specialists, and I've been able to literally call them on the phone midday and be able to talk to them about a case, about a patient, and they give me advice to be able to assist the patient. Yeah. You're not going to get that in all the big cities.
Right. What are some aspects of the program that have surprised you?
Well, number one thing about the program that's really surprised me is how hands-on it is. It's really whatever your interest is in the program, you can do. For instance, in medical school, I did not have much of an interest for women's health care, OBGYN. Within my first couple months as a resident, I did a rotation with Dr. Tedesco and his group and just loved it. I loved, scrubbing in for the surgeries, loved a lot of the office procedures. Now in my practice, I do a lot of women's care. Probably 40% of my patients come to me for women's care, menopausal symptoms, birth control. I do a lot of procedures in the office for insertions of contraceptive devices. I've actually gotten trained down in Vegas to do some procedures in the office that a lot of family practice physicians do not do.
I did back in December. I attended it was a C-section with Dr. Jackson, and I did a show on it. So they were in there delivering the baby, and I was holding a boom mic over the table. And so just now when we were meeting, I was walking through the cafeteria, and I heard him play the lullaby that they do when the babies are born. I had that experience, and now it's been so illuminating for me. It's really changed me. It's amazing. I don't know where I'm going with this. I'm just mentioning it.
Well, you're right. It really is life-changing.
Yeah.
I still remember the first time I delivered a baby as a student.
Yeah.
I teared up with the family. I was so excited. It wasn't even my kid. And I was just very excited just to be able to share that experience with them.
Yeah.
It's just a life-changing experience.
Yeah. And I was in there with the microphone, and I couldn't deliver a kid, but there was something special about it for me. I've always been a geek about sounds. And there was something special, it still is when I think about it, the first sound that little kid made in his life. I was there and I captured that. There's something really cool about that. There's something really powerful about it.
Yes, I agree.
Yeah. So let's take a step back a minute. We were talking about this program. If this were my first day as a resident, I just showed up and I said, "Hey man, what should I be looking out for? What should I know?" What kind of advice would you give me?
Well, basically what I would tell you is really just come in with an open mind. Take every patient for what it is. Learn as much as you can. Every month, every rotation is different. There are some rotations where you're going to work 80 plus hours a week. There's some rotations where you're going to work 40 hours. That doesn't mean that you're going to learn less on those less intensive months. That just gives you more time to study. So really what I'll tell you, what you put in is what you get out. You can learn from every case. Every day you're going to learn something. What you do with it is up to you. This program is great because, like I said, if you do have a strong interest for something, the program is very supportive of it, and really you can make it your niche.
I know a fair amount of residents will come in and do their time, and then they'll maybe head home or go back to a different town, or they'll get a job offer somewhere else in the country. I understand that, but you're sticking around.
Yes, I am.
Yeah. So you've already signed a contract, is that right?
Yes,
Yeah.
about 2 months ago.
Oh, tell me about it.
Well, I have signed a family medicine contract to be working at Mountain Shadows Family Medicine. I'll be starting July 2016. That's when I'll finish my residency program. I'm just very honored. The hospital approached me a couple months back, and there's a mutual agreement. I definitely wanted to stay here in Kingman. I love the community. I love my patients. I felt honored that the hospital felt the same way about me and offered me a contract, and kind of went from there.
Well, now, I'm not trying to get you to talk yourself up or anything, but I'm just wondering, is it common to approach residents so early on?
No, it's not.
Yeah.
Usually residents start to look for job opportunities, or hospitals really start to approach residents middle of their third year.
Okay.
That's the time when you really want to kind of kick it in high gear as far as looking for a job and really kind of setting your career up.
And you were just in your first year.
Correct.
That's pretty good.
Yes. It's definitely an honor. It means a lot to me, and I feel very honored that the hospital shows this much faith to me, and I definitely will not disappoint.
It's got to feel really nice too to have that security, to have something locked in. I mean, if you're a new doctor just entering the workplace, you're going to find work, but you might go to some hardship placements for a little while, right?
Correct, and everything kind of fell into place. Me being from Phoenix, I definitely had a strong interest in staying in Arizona. Right. I voiced that to the hospital early on. Right. Kingman's just a really good location for me. It's ideal. I have a lot of family in Phoenix, Vegas, Flagstaff, and I just love the community. I love my patients. I develop a strong bond with a lot of my patients, a lot of the faculty here, and this is definitely the place I want to start my career.
It's halftime on Focus on Your Health. We'll be back in just a moment with the rest of my conversation with Dr. Justin Garrison. This is the KJazz Radio Network. And welcome back to Focus on Your Health here on the KJazz Radio Network. This week my guest is Dr. Justin Garrison. We're talking medicine and football. So we touched on earlier that you're really interested in sports, and that's part of your background. Before you went to Missouri, you did your undergrad in Utah, is that correct?
Correct, at Weber State University in Ogden, Utah.
And so when you entered Weber State, did you have a major declared?
Well, right when I started at Weber State, it was pre-medical science was my major.
But you found out actually that you were just majoring in football, right?
Yeah, that was one of the things I learned very quick.
All right, so tell me about it.
In high school, I was very good in football. I was a star athlete. I got recruited by a lot of colleges.
What position, by the way?
I played running back.
Okay.
One of the selling points for Weber State University was a strong pre-medical program, plus being able to play college football, let alone play in the Big Sky Conference that plays Northern Arizona 2 times a year, so I'll be able to play in front of family and friends.
Yeah.
So they really kind of sold me on that. Within my first month at Weber State University, I realized that it was too good to be true.
Okay.
I love playing football. I love the experience, wouldn't trade it for anything in the world, but it was very difficult being able to balance playing college football Division I level and taking 15, 18 credit hours for pre-med.
Let's see. So I don't mean to play into a jock stereotype, but I'm going to guess that your teammates, there weren't a whole lot that were majoring in pre-med.
No, most of my teammates, if they did have a major, it was more like physical education.
Right.
Not to down physical education, but that's what they chose. And a lot of them, it's a shame, didn't even get a degree when their education was paid for as a great opportunity to really set them up for life. They really just focused on football. If I remember correctly, my first semester at Weber State, my classes were football, intro to the university, library, and a speech.
Wow.
All the classes were taught by football boosters.
Wow.
You really didn't have to go to class at all if you didn't want to. That's when I really kind of realized this might not be the best program for me, be the best option. It was a great experience, but at that time I knew if I wanted to get into medical school, this just wasn't going to happen.
These courses and these instructors, they knew, the guy, he was practicing late. He had to get up early and run or hit the weights or something like that. So they let the athletes slide. Right?
Yes, they did. And I remember the first semester I signed up for it. I was on scholarship, so I just went with the flow. In the second semester, that's when my concern was really high because second semester is not even football season. Yes, you have practice, you weight train and work on conditioning, but it's not football season. That's when I felt like I can sign up for the more advanced classes, your chemistries, the bio. And I remember signing up for those classes, and right when spring practice started, February, March, my head coach called me into his office and asked me, why did I sign up for those classes? And I had to remind him, I wanted to go pre-med, I wanted to get into medical school. Yeah. And he told me, I'm on scholarship. This is a business. They're paying for my school. I would need to reevaluate, my future. Wow. He actually offered to take me out of classes and put me in some easier classes in middle of the semester, and I would get really good grades in those classes, but I couldn't take the biologies, the chemistries, because it interfered with spring practice. Because in the spring, that's when you have spring practice, and with chemistry, you have 3-4 hour labs in the afternoon besides the 1 hour class, and it was just interfering with practice. And that's when I really knew that my future in football was more than likely going to be over, and that's when I really threw everything into getting into medical school.
So you were probably 19 or so at this point, right? So you're there on a scholarship. You obviously knew how to play ball.
Yes.
And so... But it's really remarkable. I'm just thinking about 19-year-olds. I mean, they want to go and play, and they think, well, I can get through this. I can be in the NFL. I can. And meanwhile, you're thinking about this whole other interest of yours, wanting to go into medicine. I didn't know you when you were 19, but it's pretty remarkable that you were able to make that choice.
Yeah, it was definitely a power struggle. I'm not going to lie to you. Yeah. To make the decision even worse, my family is very successful in sports. My brother played in the NFL for 9-10 years. Very successful.
What's your brother, by the way?
His name's Jay Foreman.
Okay.
Played linebacker for the Buffalo Bills, Houston Texans, 49ers, and New York Giants. He played college football at University of Nebraska, won 3 national championships in Nebraska, very successful in the NFL. So, like any younger brother, you want to top your older brother. Sure, you want to compete. Yeah. So that was a power struggle for me. Definitely a lot of soul searching with that decision, but I'm sitting here today and I feel like I made the right decision.
Yeah. When you were going through that decision, what was the support, or what were you hearing from home?
Well, I've always had a supportive family, family, friends, everybody was very supportive. Even my brother, I talked to him. He gave me some really good advice and told me his future is football. His father played in the NFL for the Vikings in the 70s, Hall of Fame football player. So he had strong genes. Me, I was definitely good at football, but at a very young age, my parents instilled education in me. I knew football probably wasn't going to be my future, so I threw all my energy into getting into medical school.
Did you have to leave the football program when you were in Utah?
I did. It was tough. Number one, I went to a private high school. I still remember sitting down with my parents, kind of going over this decision, and my parents definitely have 100% trust in me, and my dad made it very simple. He said, son, I support you in every decision you made. We forked up a lot of money for high school. I went to a private high school. Yeah. Basically, he just reiterated, put yourself in the best position to get into medical school. If that means going to a public university, try to get a scholarship. So for me, I knew I was walking away from a football scholarship at Weber State University. I applied to Arizona State University, got an academic scholarship, and I got into medical school after that.
Yeah. What happened with the guys you left behind there in Utah, your teammates?
I still talk to a few of them to this day.
Yeah. Any big success stories there?
Success is what you make of it.
Good point.
A lot of them do have families and have some family businesses they're running. They're happy where they're at, and if they're happy with the decision, then I'm happy for them.
When did your brother leave the NFL?
He left the NFL in 2007.
How's it been for him since?
It's been really good for him, professionally and personally. Personally, he just got married to a beautiful physician.
Oh, wow.
About a month ago down in Phoenix. The wedding was beautiful, and professionally he's doing really well. He owns a few businesses. One of them is a shipping business for UPS. He's a financial advisor. He's actually working on becoming an NFL broadcaster. About a month ago, he went to Philadelphia and participated in a NFL broadcasting boot camp.
Nice.
And he was one of the 3 former NFL players to be elected for it. So he has a lot of different things going on, but he's very happy and very successful.
So you have these two interests of medicine and sports. Do you see some way that you'll be able to bridge the two?
Yes, I have. By going into family medicine, that gives me the opportunity to perform or practice sports medicine.
Right.
With sports medicine, I'm able to do family medicine, and I can work with athletes at the same time. So it's the best of both worlds. Currently, I'll be the team physician here in Kingman for the football season, the upcoming football season, for Lee Williams High School and the Kingman Academy. During my medical school training, I actually served as medical staff for a lot of the high schools in Northeast Missouri. Got
cool.
valuable experience as a medical student. Now I'm just very passionate to bring that training, the expertise to Kingman.
What is that gig like when you're there on the sideline? What do you have to do?
Really, I just kind of stand by for anything, just kind of wait for any kind of injury that happens for both Kingman High School and their opposition.
Right.
It's very challenging, though, I must tell you that, especially in a lot of the smaller communities, more the rural communities. Because let's be honest about it. A lot of the kids in this community, they're not going to be Division I athletes. Right. They're not big. They're not bulky. So when they play a lot of the bigger schools from Phoenix or Vegas or what have it, a lot of injuries happen.
Okay.
Unfortunately, a lot of traumatic brain injuries, a lot of concussions.
Yeah.
So having a medical provider game sign is very important. And that's a service I felt this community didn't have, and I'm honored to bring it.
It's very cool. I mean, it's such an interesting way for you to merge these two interests of yours. You obviously have to stay up on the literature in terms of concussions and
yes.
trauma. And we hear more and more about this stuff all the time. What are some of the things you have to keep an eye on for these kids?
Well, basically, I have to have eyes everywhere,
yeah.
watching both teams, watching the game, watching the sideline. A lot of times a hit might not look like a big hit, but you still have to watch the athlete, how he responds. If he gets up, he's a little wobbly, if he's complaining about headaches, all those are signs as a physician, I need to be able to jump on early to be able to have a better outcome.
So that's the serious, the grave kind of stuff, but probably a lot of sports medicine is more the everyday functionality, right?
Correct. Like muscle cramps. Do you watch basketball?
Yeah, a little bit.
Did you watch the NBA Finals?
Yeah.
First game of the NBA Finals.
And LeBron went down
with the muscle cramp.
Yeah.
That's the most common injury we see this time of the year in Arizona.
Especially here, right? Yeah.
115-degree heat. Athletes have, 5-10 pounds of pads on. They're not drinking plenty of fluids. Muscle cramps. We see it all day.
Right.
After that, heat exhaustion. Basically, athletes are not drinking enough water. They're running around all day. Their blood vessels are dilating. They become very big, which is important. You need them to be big. You need blood to go to the skin. You need it to cool down your skin. You need it to go to all the organs to perfuse correctly. When they stop, they're not getting that adrenaline kick. They're not getting that increased cardiac output. Mm-hmm. Basically, blood kind of pools down at their legs. It doesn't go up to the heart, and they pass out. That's what heat exhaustion is. That's the second most common injury that we see.
What can we do about it?
It's really education. It's my job as a primary care physician to be out there with the athletes, to be able to talk to them about how much water they drink. Typical athlete loses 1.5 liters per hour of intense exercise. That's a big number.
Yeah.
If they're not drinking enough water, enough Gatorade, they're going to cramp up. They're going to pass out. So as a health provider, I have to be able to educate them about how to treat their body, how to train their body, not besides lifting weights, but about nutrition, eating right, drinking the right fluids. Athletes practice 2 times a day, early in the morning and usually in the afternoon.
So the afternoon, I mean, that's the heat, the thick of the heat, right?
That's the thick of it, and that's when we worry for a lot of these heat injuries. Being able to educate the athlete when they get done working out in the morning to go home relaxed, replace those electrolytes, prepare your body to go through another grueling 2 hours of practice in the evening.
Wow. It becomes an endurance race over the course of a season.
It does.
Right?
But that's what breeds champions.
That's Dr. Justin Garrison. You can make an appointment to see him at the resident clinic at 928-681-8701. That's 681-8701. Dr. Garrison, thanks so much for joining me.
Thank you, TG.
And that's the show. Thanks for listening. I'm TG LaFredo. Please join me again next Saturday at 11:30 a.m. for another edition of Focus on Your Health, right here on the KJazz Radio Network.